Right.
Okay, we've another update for you today on the coronavirus issue with Dr. Nadir Ali, MD, who's a cardiologist and a pretty heavy researcher. So he's going to go through some of the mechanisms around the ACE inhibitor drugs and how they may make you more prone to severe infection. And some of the drugs may also alleviate problems. So it's going to be a fascinating discussion. I'll just say up front as well that today, April the 3rd, we have released our movie, Extra Time, and it's available at ihda.ie and extratimemovie.com. So it'd be great if you can support us there. Fantastic hour-long documentary all around heart disease and how you can actually reverse it. So that'd be cool. So great to see you again, Nadir.
Hey, Ivor. Thank you for doing this podcast. I wanted to do it on my own on my YouTube channel, but then I realized it'll not get the same traction that you have. So I wanted many people to be able to view it. So I asked you to do it and you kindly agreed. Thank you.
No problem, Nadir. Not a second thought when you rang me earlier. No, we're trying to get out some updates. Again, we don't want to overreach. But this is obviously a huge issue, so it's timely to get out expert opinions and good research and data. And today, actually, you're going to speak on something I picked up on the last few weeks, that a huge amount of hypertension and diabetes and cardiovascular disease is present in the most severe cases and deaths. And I believe the American leadership have also called out question marks around the widespread use of certain drugs in people like that. And the question is it more the people's conditions that's driving the severity, or is it possibly an interaction with the drugs that are so massively used? So I suppose you can kick off in your own words and keep it high level for the audience, not get too much into the weeds. That'll be cool.
That's awesome, Ivor. And I think the first thing we should mention is that we are doing this for information purposes only. We are not recommending that people stop medications or change medications. And we are not even sure if anybody has the right answers yet, because there are both pros and cons to using medicines which are called the ACE inhibitors or the angiotensin receptor blockers. And the reason these medicines have come into forefront is because when you take these medicines, it increases a certain receptor in our cells, which is called the ACE2 receptor. So as the ACE2 receptor goes up, that is the mechanism through which the virus gains entry. This is the SARS-CoV-2 virus. It gains entry into our cells. So this, I'm sure many of us have seen the picture of this SARS virus, the COVID-2 virus. It's got these spikes, these projections from the virus. And these are called the glycoprotein spikes. And these spikes hook onto the ACE2 receptor that's on our cell surface and gain entry. So the reason it came to forefront and the reason I think it's important for us to explore this further is because when you take certain blood pressure medicines, you increase the number of ACE receptors, and hence it is potentially possible that you are increasing your risk of infection. And perhaps if you have a larger inoculum of the virus, which means if you have a larger dose of virus that you are getting into your body, you can get a more virulent type of infection perhaps. So you will notice me saying maybe and perhaps because none of us are very sure about how this virus behaves. There is a variation from very mild illness to very severe illness in which people are on ventilators, get severe lung injuries, get heart injury. There is a risk of death in a certain proportion of patients. So the illness is quite variable. I also wanted to point out that the number of people taking these medications is quite high, because if you take hypertension, it's a common disorder, and about 50% of patients who are hypertensive perhaps are on this drug. And a near 100% of diabetics are recommended to take this drug, and patients with certain heart conditions are also on it. So when you look at the information from China, there was a recent article that was posted in New England Journal of Medicine, a little over 1,000 patients. And when it was analyzed as to who is getting this infection, it was found that the people at the top, the highest percentage of people getting this infection with coexisting conditions, in other words, conditions that were there before, is hypertension. The next group is diabetics. The third group is people with heart disease. So I thought that it would be important for the lay public to know the details about this.
Oh yeah, no, that's great, Nadir. That's exactly it. The jury is out, of course, as with any breaking issue. That's not surprising. But again, the very powerful links of hypertension, diabetes, cardiovascular disease, as you say, and COPD, a very, very powerful bias for the worst cases and deaths towards those conditions. And as you just said, there's enormous prescription of these particular class of drugs for those people. So very hard to tease it apart. And it's great that people, you'll explain kind of how this works and what the mechanisms are. And people then, of course, can make their own choices on anything.
And that's correct. This is for informational purposes only. And what I wanted to kind of reiterate is that I'm going to put in the links, and then maybe you can post in the slides that reference the New England Journal of Medicine study with over 1,000 patients that shows that not only are people who have coexisting conditions, the hypertensives are represented in a greater degree, but also people who have bad outcomes, like being on a ventilator, getting heart muscle damage, getting lung damage, or dying. There is a disproportionate representation of people who have hypertension, diabetes, and heart disease. And of course, you could say that the reason that this is happening is because these coexisting conditions make them predisposed to having these problems. But at the same time, there is perhaps a play of the ACE2 receptor. So the ACE2 receptor goes up when you use these drugs. So it would be a little important to get into the weeds as to what the ACE inhibitors and the angiotensin 2 receptor blockers do. So our kidney elaborates a substance that promotes the conversion of angiotensin to angiotensin 2. So angiotensin 2 is a substance in our blood that increases blood pressure, that makes us retain salt, that increases our thirst mechanism. So it's an important substance for our survival in certain situations. But what mainstream medicine has discovered is that blocking angiotensin 2, it functions through a receptor. So using a receptor blocker for this drug, it helps control people's blood pressure. The second group of drugs that they use is called an ACE inhibitor. An ACE inhibitor prevents the conversion of angiotensin 1 to angiotensin 2. But the problem with these drugs in our particular situation is that when you use these drugs, there is all kinds of human and animal evidence that it counter regulates and increases the amount of an ACE2 receptor. So when the ACE2 receptor goes up, you are potentially increasing viral entry into the cell. I always like to go back to what you tell, Ivor, which is that mainstream medicine always considers treating diseases with pharmaceutical drugs without paying attention to root causes. So the most important mechanism, or the most important question for mainstream medicine to ask is, why is somebody getting high blood pressure, rather than going and blocking the action of angiotensin 2? Because the body never does something without creating checks and balances. If it increases the levels of angiotensin 2, it has counter-regulatory mechanisms to control angiotensin 2 levels, or to have other substances that would prevent the action of angiotensin 2 from getting out of hand. And ACE2 is one of those mechanisms, because when the body elaborates ACE2, it creates a few other substances which are angiotensin-like, but they are smaller in size, and they drop the blood pressure. They improve the vasodilatation, which means that they enlarge the blood vessels. So by just paying attention to blocking angiotensin 2 receptor, you are ignoring that there could be other counter-regulatory mechanisms that can be activated that can perhaps be detrimental for you. And in this particular situation, the unfortunate fact is that you're increasing a receptor through which the virus is gaining entry.
Yeah, and this is, it's not really a case that the ACE2 or the receptors are kind of slightly encouraging the virus entry, and like there are 20 points of entry biochemically, and the receptor that we speak of is just one. Is it kind of almost an exclusive entry? So the virus is very, very dependent on that point of entry as to how much virus will actually come in and how much will begin to enter cells and start replicating itself and start the whole cascade. Is it pretty much almost exclusively around this receptor?
So yes, the answer to that is that the virus can only gain entry into our cells through the ACE2 receptor.
Okay.
Because there have been studies done, in other words, they have taken mice and have done an ACE2 knockout mice. An ACE2 knockout mice means that these mice do not express the ACE2 receptors. And when exposed to the older SARS virus, newer studies have not been done, and when exposed to the older SARS virus, the mice did not get infected when they had an ACE2 knockout.
Yeah. Okay,
it's also important to mention that one of the mechanisms by which the glycoprotein spike, the spike on the virus, gets activated is through a mechanism in the body called furin, F-U-R-I-N. And furin modifies that glycoprotein so that it sticks better to the ACE2. And the reason I bring that up is because furin is a very important regulator of LDL, which is considered to be the bad cholesterol. And furin modulates the level of LDL by activating or deactivating PCSK9. So that's just a little side note that you may or may not to insert into the event that we are doing today. But the reason I say that is that whenever you try to mess with how nature has designed the blood pressure control system or the cholesterol system, you're not just creating one effect, but you are changing many counter-regulatory mechanisms that the body has designed so that it can function properly. And that's the reason why I like your approach, which is go to root causes and see how you can alter the root causes to improve health and not rely so much on pharmaceutical medicines, because using medicines is like going into a crowd and opening fire into the crowd and hoping only to hit the terrorists and not have any collateral damage.
It's a really important point, Nadir. I agree. And no, thanks for that. But, you know, I often think of it as they really want to get a rifle, you know, with a telescopic sight, but they kind of end up with a shotgun. And that's not because, you know, they're not trying hard or they haven't put a lot of money into it, but the biochemistry of a human machine is so complex that exactly what you say occurs. It is very hard to get a rifle shot because all the other mechanisms and all the other feedback loops, they're all completely overlapping with each other and all compensating for the other ones when you hit one. So it's very much a shotgun generally, even when we like to think of drugs as precision medicine. And the statin class, as we know, have multiple pathways to affect, even vitamin K2 pathways, and many others besides the basic cholesterol one. So point well taken. So then maybe that moves on to whatever about your choices, which are medical professional at this time around these drugs, the things that you can do to affect blood pressure. And I agree also, I think fixing root cause in engineering or in medicine or in disease, it will always, when you do it properly, get you way better results than the shotgun. It's just the way it works. So maybe we could talk about some of the methods you could use.
So what we like to do is a bit of self-promotion and tell people where we come from. But before we do that, I want to put proper balance to this topic. And the reason I want to create balance is because we are not about fear mongering. We are not about telling people that we know things best. We want to create balance. And the balance I'm saying is that there are studies that show that blocking the angiotensin II receptor, in other words, the very blood pressure medicines that I'm talking about saying is increasing the risk of a COVID-2 infection, in several animal studies and some human data has shown that using the ACE inhibitors and the angiotensin II receptor blockers reduces severe lung injury, because the angiotensin II, when it sits on the receptors, it creates certain situations in the lungs, causing vasoconstriction, reducing blood flow, causing other damage to the lung that can be prevented by using these drugs. So at this time, in the infectious disease community, the bug doctors and the certain cardiologists by and large are a little bit unaware of the weeds of how the ACE2 receptor interacts and causes this disease. But there's a vigorous debate going on in which many of my physician colleagues are saying that these drugs need to be stopped. There are other people who are promoting the use of this drug in order to prevent severe lung injury. So on the one hand, you don't want to have this drug on because it will increase the risks of infection. But once you have the infection, maybe you should have this drug on to prevent lung injury. So I wanted to make sure that that balance is created. But then I wanted to get back to your larger question. And the larger question is that people like you and I and Jason Fung and Megan Ramos, and here is my shameless self-promotion because I belong to IDM and the fasting method. And what we are saying is that go for root causes. One of the primary reasons for having high blood pressure is being insulin resistant. Work on your insulin resistance. We eat many meals a day. That is likely to increase your blood pressure. Fasting is one of the best mechanisms to reduce blood pressure. We are in a mode of sedation. We don't exercise. Exercise is perhaps one of the better methods of controlling your blood pressure long term. We don't get enough sunlight. Sunlight not only promotes vitamin D, but it promotes the generation of nitric oxide in our skin, automatically reducing our blood pressure. There is a large proportion of our population that's vitamin D deficient. Vitamin D is important in blood pressure regulation. We are deficient in vitamin K2. We don't entrain our circadian rhythm. The circadian rhythm is the day-night cycle that we can enhance by getting exposed to natural light during the daytime and shutting it off after sunset by wearing either blue light filter glasses or avoiding screens so that we can sleep better. When we sleep better, our blood pressure is better controlled. So I implore the medical professionals, people like me, to reduce their focus on medicines and improve their focus on root causes. And I'm promoting my organization to say, hey, come to the fasting method and learn what we have to offer. Now, that's a long-term solution. By no means am I saying that stop your blood pressure medicines, because I don't know that answer myself. The reason I'm saying all of this is because I want there to be a grassroots effort. I want people to demand that we know better about the interaction of ACE2 with the novel coronavirus and do studies that do not have conflict of interest from the pharmaceutical industry so that we find out whether these drugs are detrimental to us or beneficial to us in this situation. And very often, if you have looked at, and you have looked at some of my presentations, we don't get the right information because of the conflict of interest that is pervasive in drug literature. So with that, I think I should stop.
Wow, that's fantastic, Nadir. There's a lot to unpack there. But yeah, I love your list because that hits all the big things for blood pressure. And I suppose people should also realize that ancestral peoples living ancestrally, eating ancestral nutrient-dense foods particularly, they don't get hypertension with age, even in their 60s and 70s. Many studies on the Maasai, on the Catavans, the Semaine peoples, no calcification really, no real atherosclerosis, and no hypertension as they age. And then when these people, these genetic peoples, move to the cities and start eating the modern processed foods, then they get the hypertension in their 40s and 50s getting worse and worse and worse. So there's no question, but you can cut off the cause at the root. And the only one I'd throw into your beautiful list there is magnesium, I think, is probably just another one that's probably quite key. But there you go. And just circling back on the good and bad with these drugs, well, simply put, there's a known potential negative because it directly promotes the receptors that are the gateway, unique gateway for this new virus to come in. So that's certainly a concern. And then, of course, as you said, there's a possibility from animal experiments that they may alleviate later stage disease by helping the lung, maybe mitigate things. So I guess people have to weigh that up. And of course, work with your doctor, who hopefully will be becoming much more informed on this. And yeah, that's it. That's a really great update on these ACE drugs, and that people are aware about them, and also that they know that you can drop your blood pressure. One last thing I'll just mention isn't it ironic that if you go on a low carb diet or a fasting protocol, like the fantastic guys at thefastingmethod.com, Jason and Megan and all, if you do that, there's a warning to be careful to talk to your doctor about blood pressure medications, because your blood pressure may go down too low, too fast, and you may have dizzy spells. Isn't that incredible that you have to give that warning that, look, if you start fixing the root causes, be careful, you may have to come off your blood pressure lowering drugs. That's a risk. You know, that's how effective it is, really, pretty much. So great stuff, Nadir. Any other thoughts to close this and keep this a tight production?
I love the fact that you ended the podcast on a balanced note. And the balanced note is that we are putting out information. We are not suggesting that people stop their ACE inhibitors or their ARBs. I think that the important associations are saying that don't stop these medicines, but don't initiate this medicine on a person who's at risk of a COVID infection, which I think at this stage is almost everybody in the world.
No, that's great, Nadir. And we'll circle back again in the coming weeks with other updates like I'm doing with a few people at the moment. That'd be really cool. And we do have a new movie, a full kind of feature movie documentary with Irish sports stars. We scanned 45 with the calcium scan, and we followed one sporting hero. And he became a hero for a second time, as you'll see from the movie, and tackled his heart disease, massive heart disease, to stop and reverse it. So that's on the homepage at ihda.ie. It's $3.99 to stream. And it really helps us if you grab that movie, enjoy it at this time, difficult time when we're pretty much all stuck in, but also really get the message out to other people, because this too will pass, this problem. But the problem of cardiovascular disease, the biggest killer in the world, diabetes, hypertension, all these things, they're going to keep going. And they're going to exacerbate the next virus that comes around. And they're going to kill countless millions without any virus being around. So if you could help us with that, really appreciate it. So thanks a lot again, Nadir, and see you next time.
Thank you, Ivor.